Welcome back everyone to our next micro lecture for this module. As I mentioned at the end of our last session, we will be focusing on more of the historical aspects of CNS depressants and how they became such a commonplace medication in the lives of so many Americans. Let's go ahead and get started. Our country has always had a love-hate relationship with alcohol, and near the end of the 1800s, really throughout all of the 1800s, but particularly near the end of the 1800s, we saw a strong movement towards prohibition, the temperance movement. As people were viewing alcohol in a negative light and were pushing to outlaw it, there was also a large push for a substitute. Enter bromides. Bromide compounds, especially potassium bromide, were frequently used as sedatives in the 19th and the early 20th century. Their use in over-the-counter sedatives and headache medicines, such as bromo seltzer, in the United States extended to 1975, when bromides were finally withdrawn as ingredients due to chronic toxicity. Bromo seltzer was also used as an antacid medication. It was basically a precursor to things like Alka-Seltzer and Tums. Lithium bromide was very popular in the early 1900s, but was discontinued in the 1940s once barbiturates became even more popular. Lithium was very corrosive and ended up killing the lining of your stomach if you took it for too long. People were getting stomach cancer from taking it. Lithium is actually still used today in the treatment of certain mental health diagnoses, such as bipolar disorder. However, the main problem with bromides resided in their high toxicity, neurological and gastrointestinal disorders, irritability, hallucinations, deliria, and lethargy, given their long half-life. Basically, it took 12 days to eliminate it. And the capacity for the accumulation in the tissue. As a result, they were gradually phased out after the introduction of barbiturates in the early part of the 20th century. Barbiturates were actually developed by a German chemist named Adolf von Baeyer in 1864, as he experimented with a chemical compound derived from apples. He named the compound barbituric acid after St. Barbara's Day, the day he discovered the drug. Basically, he tested the drug on himself, colleagues, and locals who frequented a nearby tavern. He discovered that he had created a psychoactive drug that he named barbiturate. When given to humans, it induced sleep and was one of the first chemically created hypnotic drugs. As with many of these inventions, the desire to market the drug overshadowed the appropriateness of the compounds, a problem that is still prevalent today. In this case, the original barbiturate induced sleep, but it metabolized slowly, meaning that a person was sleepy and under the influence long after the desired 8 hours of sleep. In 1912, other chemists developed phenobarbital, which is still used today. It was found that it helped to lessen the severity of seizures in its patients. To counteract the overpowering sleepiness, they merely added amphetamines to the mixture, and the drugged feeling was covered up by the speed effects of the amphetamines. In other words, by adding two counteractive drugs, we see one drug, the amphetamines, drowning out the effects of the barbiturates, so it's not as strong. In the early 1900s, bromides were replaced by barbiturates, which were initially heralded as safe and effective alternatives to the bromide drugs. However, it became quickly apparent that there were problems with tolerance, dependence, and safety. Compared to the bromides, these were much safer. That's true. They have a shorter half-life than bromides and are less toxic in comparison. People were still able to function when taking them, and they weren't sleeping for hours on end. But as time went on, we realized there were big issues, as I mentioned. Tolerance and dependence were big issues. People relied on barbiturates for everything and took them all the time. When they first came out on the market, these drugs were injectable, as pills were not necessarily a common practice yet. So with all types of injection-based drugs, we see a narrower margin of safety, which leads to a higher likelihood for overdose. As we still use barbiturates today, but on a less frequent level than we did in the past, anything that you see as a barbital drug is a barbiturate. For example, phenobarbital is still used as the treatment for epilepsy in developing countries. Very rarely prescribed in the US anymore, but it is considered the oldest form of anti-seizure medication. Pentobarbital is still used for the execution of prison inmates and for the euthanasia of animals. Because barbiturates were considered to be too addictive and too dangerous, chemists went back to the drawing board once more and continued to tinker with the chemical compounds that they already had. In the 1950s, the first benzodiazepines were marketed as substitutes for barbiturates. Once again, these were promoted as being relatively safe when used for short periods of time. Long-term use can cause dependence and withdrawal problems, much like their predecessors. In the 1950s, Leo Sternbach, a research chemist, began tinkering with an unknown class of compounds, the BZDs, or benzodiazepines. Over several years, he tested some 40 benzodiazepines, but all proved ineffective. Finally, in 1956, after adding methylamine, a colorless gas derived from ammonia, to one of the compounds, he produced a white powder that made mice sleepy and calm. The Food and Drug Administration approved Librium, the very first ever benzodiazepine, in 1960, and Valium in 1963. Benzodiazepines latch onto a receptor in the brain, which then activates a neighboring neurotransmitter known as GABA. GABA release makes people calm and sleepy. The drugs can trigger that GABA rush in minutes, allowing a user to feel more calm almost immediately. Initially, benzodiazepines were hailed as a medical miracle, and they soon became the most widely prescribed class of drugs in the world. Even though the drug's addictive properties have now become clear, they remain widely available and are often prescribed for longer than the recommended 2 to 4 weeks. Tolerance to the drug is thought to develop because benzodiazepines weaken the response receptors of the brain. That means a benzodiazepine user needs to keep ramping up the drug's usage, or dosage rather, to trigger the same calming effect of GABA. Probably the most famous benzodiazepine user, Marilyn Monroe, was a chronic pill user, which ultimately resulted in her overdose and death. Marilyn Monroe had a severe history of depression and several failed marriages and miscarried several times throughout her young life. Things really started to go downhill for her in 1961 after she divorced her third husband, Arthur Miller. She suffers a mental break and is admitted to the Payne Whitney Psychiatric Clinic in 1962. Her second husband, Joe DiMaggio, comes and gets her out and tries to remarry her to get her away from the doctors and the people she's surrounding herself with. She is prescribed an abundance of pills at the facility to help her cope with her latest divorce and miscarriage. After her release from the clinic, she's living at home for a little while before she overdoses. In early August, she fills a prescription for 25 Nembutal tablets. We also know this as pentobarbital. On August the 4th, she has an at-home meeting with some business partners and her psychiatrist as well. After everyone left her house, she retired for the evening around 8 p.m. Actor Peter Lawford calls her up shortly after that and asks her if she wants to attend a party on the night she dies. Lawford reported that she sounded like she was under the influence of drugs and told him a very long goodbye, which was very unusual for her. Lawford calls assistants and other individuals that would be able to go check on her, and he was assured that she was fine. Marilyn Monroe was discovered naked and unconscious with an empty bottle of pills around 3:30 a.m., by her housekeeper, who had to break into the room through the window due to a locked door. Her housekeeper called the doctor and the police, who confirmed her death. They ruled her death an overdose and say she had more than 40 pills in her body at the time of her death. An autopsy report concluded that she had 8 milligrams of chloral hydrate and 4.5 milligrams of pentobarbital, the Nembutal, in her blood, and a further 13 milligrams of pentobarbital in her liver. No other signs of foul play were found on the scene. Everyone remembers how she died and the circumstances surrounding her death. Benzodiazepines did not lose their popularity at the time, however. If anything, they became even more popular. Benzos became so widely prescribed that it seemed like everyone is taking them all the time. They are considered nearly harmless compared to earlier forms of the drug. People believe that we now found the right one this time. They're not very habit-forming. This is the solution to help solve our anxiety. The biggest one is the production of Valium, which was originally produced as a little yellow pill. Quickly becoming known as Mother's Little Helper with some help from the Rolling Stones, it becomes super popular overnight. Valium is now more than 50 years old and is the first drug to reach $1 billion in sales and was the leading prescription from 1969 to 1982 every single year. This is an actual advertisement for Valium that was published in 1970s, which portrays Jan as, quote, 35, single, and psychoneurotic, whose low self-esteem prevented her from finding a man to, quote, measure up to her father. A series of snapshots span 15 years of Jan's failed relationships, culminating in a picture of a matronly woman standing alone on a cruise ship, the fate from which Valium might save her. The advertisement also provides these nice words about Jan and how Valium would solve all her problems. The ad states that, quote, the purser on her cruise ship took the last snapshot of Jan. You probably see many Jans in your practice, the unmarried with low self-esteem. Jan never found a man to measure up to her father. Now she realizes she's in a losing pattern and that she may never marry. Valium can be a useful adjunct in the therapy of the tense, over-anxious patient who has a neurotic sense of failure, guilt, or loss. Over the years, Valium has proven it's valuable in relief of psychoneurotic states, anxiety, apprehension, agitation, alone or with other depressive symptoms. So what do we see from this ad? It is very clearly directed at women, the number one patient who would be prescribed Valium at the time. Presumably, the doctor would be male and would serve as the savior for Jan and cure her problems. Through the prescription of one little pill, it would change the life of her patient. That's a very huge promise from one such pill. It is probably not a surprise to you that Valium and other benzos became more popular in nature. The side effects of those drugs became more widely known as well. As the medical community became aware of the problem, use of some depressants declined, but benzodiazepines remained still very popular. These medications are considered Schedule 4 drugs, which means they have a recognized medicinal value and do not have a very high potential for abuse. They still require a prescription, as we know, but they are not considered as serious as drugs found in the first 3 schedules. Depressants are usually classified according to the degree of their medical effects on the body. For the most part, these drugs have 2 main effects. First, those in the sedative groups cause mild depression and relaxation for the patient. They are considered anxiolytics or drugs that relieve anxiety. They keep you calm, they relax you, they help you breathe a little bit better, and you're less anxious overall. Secondly, hypnotics induce drowsiness and encourage sleep. They have amnesic effects which can cause loss of memory, and they can knock you out. These are the sleeping pills and those that can cause memory loss. The thing to remember with these, that there are two different types of medications in these doses. The sedatives are generally a lower dose medication. You're taking these with the hope that you'll still be able to function while you take the medication. The hypnotics are much stronger of a dose. You are not trying to function when you take these. You're trying to go to sleep and be unconscious to rest and recoup. These drugs can come in higher doses in hospital settings, as anesthetic benzos are often used as a local anesthetic or even as a general, but they do not have any sort of pain relieving qualities. Therefore, most hospitals only use them for short procedures, as patients cannot tolerate that much medication in surgeries, which last for hours at a time. There are currently about 15 different types of active benzos that are available for prescription in the US. All of them have similar side effects, but the most common one is drowsiness, because they are depressants after all. Side effects include drowsiness to paradoxical effects, meaning increased restlessness, tolerance, dependence, withdrawal, and abuse. Additionally, these drugs are distinguished by the duration of action. Hypnotic drugs often have a shorter half-life, meaning that you will need to take more of the drug in a shorter amount of time in order to keep the effects going. Drugs like sedatives have a longer half-life, which means you need to take them less often. This makes sense, as the sedative drugs are meant to allow us to function and relieve the anxiety that we feel throughout the day. The hypnotics, on the other hand, are meant to put us to sleep, but not keep us asleep forever, which is why we prescribe them only to patients who cannot rest well. People most likely to abuse CNS depressants include individuals who use drugs to relieve continual stress. This is when it is no longer about the effect of the drug, but the tolerance is strong enough that it's just about trying to keep normal. The individual is so used to having benzos in their system that they are stressed out without it, and they need it to feel normal. They are also used to paradoxically feeling euphoria and stimulation from depressants. We are talking about benzos as depressants. If it is a depressant, then how can I feel stimulated? Certain drugs can produce a stimulant feeling if the user's tolerance is high enough. Ever see someone who's very talkative and a very excitable drinker? The first few drinks produce a stimulating effect until you hit that threshold dose and the depressant factor kicks in. Individuals also use depressants to counteract the unpleasant effects of other drugs of abuse, meaning I may take stimulants and counteract them with depressants. Or I combine depressants with alcohol and heroin to potentiate the effects of the drugs, meaning I take two depressants to strengthen the depressive effects of the drugs. So in addition to their prescribed use, we are seeing individuals using these drugs for a variety of other reasons, including drug enhancement. You would imagine that if folks are using these drugs for enhancement purposes or for recreational use, the potential for abuse increases. And when use eventually stops, detoxification will kick in. Detoxification indicates the elimination of a toxic substance, such as the drug and its effects. The tolerance for these drugs is strong, and you cannot withdraw from them without supervision. Withdrawal can be fatal, unsupervised, if you just go cold turkey. So they basically wean you off, and they give you low-dose sedatives that will have a longer half-life to get your body used to the idea that you are not receiving high doses of these meds anymore. Withdrawal is actually managed with longer-lasting barbiturates in smaller doses, similar to how methadone is often prescribed to opioid users as a way to help detox from other drugs. In this micro lecture, you can clearly see the benefits and the dangers that are associated with the use of CNS depressants. When used correctly, drugs like Valium and Xanax can significantly improve the lives of their users without causing significant harm. However, long-term use and overuse do suggest that these drugs have the potential for harm when used inappropriately. In the next lecture, we will turn our attention to stimulant-based drugs such as codeine, amphetamines, and more. I'll see you next time.